Welcome back to the front page. It's Wednesday, which means your eye on health with Dr. Sudip Bose from Medical Center Hospital. Doc, thanks so much for joining us. Now we're approaching, the colder weather is coming in and we're approaching holidays, but this is a time that people get depressed for some reason.
You know, the days get longer, it gets cooler, we have less sunlight outside, and today's topic is seasonal affective disorder.
Right, and I can think of a lot of people that I know personally who do have a harder time in the winter months, and it's odd that it happens this time of year.
Yeah, and those patients with seasonal affective disorder, they actually improve when they have light therapy. And this doesn't mean going to a tanning booth. Yeah, exactly.
Right, that's funny. I have some friends who lived in Anchorage, and they say that they actually they have tanning beds in their home because it brings up their spirits.
Yeah, and
that's not the case here.
We're not recommending that. We're not recommending that.
Right.
And so let's first talk about some of the symptoms of depression, which is seasonal affective disorder, causes depressive symptoms. So, these are patients who aren't sleeping as well or sleeping way more. Their sleep patterns are disrupted. Right. They're losing interest in activities they used to enjoy doing. They feel guilty, hopeless, decreased energy, decreased concentration, appetite changes, things like that. So those are some of the
Why
symptoms
now, though? Why this time of year?
Well, the seasonal affective disorder, the thought is like the light therapy, when the light actually goes in your retinas, it signals certain parts of your brain. And, these depressive symptoms, they're actually neurohormonal balances. The levels of serotonin, dopamine, everything in your brain is not quite where it should be. So this isn't your fault if you're feeling depressed.
Don't blame yourself.
Yeah, it's actually something chemically going on in the brain. So,
and I'm sure with the holidays, a lot of people get depressed this time of year, being away from their families, or it's a time where, if you lost a loved one, you kind of remember them, especially during this time of year.
Exactly, and we're going to talk about holiday stress and holiday depression as we approach the holidays, but that is very common. But here we're talking about seasonal affective, so the light, causing depression. So we've talked about the symptoms of depression, and now let's talk about the treatment. And as a society, sometimes we run to antidepressants. That's what's going to help us. But, there's been studies out there where exercise has done better than antidepressants.
Wow.
And it makes sense. You're increasing the endorphin levels in your body, you're living a healthier life, and if you have seasonal affective disorder, you might be going outside for a jog or a walk.
Get some air and some sun, Well, I'm an advocate for that, you know that.
Exactly. And let's think of other things besides medicine, social interactions. Pick up the phone, call your friends, join social activities, comedy, if you have a spiritual belief, getting in touch with your spiritual side, eating a nutritious meal, that makes you feel better. Right. So all those things, but if that's not helping, then maybe it's time to get some care. And especially if you're feeling like you want to hurt yourself, if you're feeling suicidal, definitely the emergency room's open 24/7. 365, and we can help you. Don't hurt yourself out there.
And it's okay to seek help. A lot of people feel like that they're giving up, or that they aren't themselves. But like you said, it is something happening inside of you, and you're not to blame for it.
It's not a sign of weakness. I mean, we see this in U.S. soldiers. After our combat deployment, when I went to Iraq, people who come back with PTSD and depression, they view it as a sign of weakness. These macho guys. So it's a similar concept here, where it's not a sign of weakness to get help. It's actually, it takes strength to realize you need help.
Absolutely.
You take control.
All right, Doc, thanks so much. Great topic, and I'm sure we'll get a lot of people asking questions about this. And like you said, we'll have more on depression during the holidays in future segments.
And we'll have more on whatever you guys want to hear. If you want to submit it on our Facebook page, Dr. Sudip Bose, Robert Guaderrama, and we'll answer whatever you want.
Or the email there at the bottom of your screen. Go to submit those questions, and we love answering your questions that you have here on the front page. We'll be right back. Stay with us.
Thank you.